Good afternoon, everyone. So I was thinking as I was watching people, I was actually really impressed by how much energy there is in the room for the fact that it's right about that hour that I usually crash in the afternoon. So my challenge to our panelists is going to be to ignite, and it's innovation, right? So you're going to be able to ignite us through the next hour or so. So thank you. I'm honored to be here. It's been a great conversation today. Again, I'm Tracy Wareing. I'm the Executive Director of the American Public Human Services Association. For those of you who don't know who we are a national membership organization that represents top-level public sector leaders from across the country who are responsible for delivering human services, and in many cases, health and human services across the country and the states. Cabinet-level appointees and the senior-level administrators of the things that we've been talking about today, child welfare, SNAP programs, TANF, and the like. And so I'm honored to be here because one of my personal commitments, both from a professional standpoint and just something I'm deeply passionate about, is the fact that we have this incredible network represented here in this room and across the country on both the public and nonprofit side, as well as the business sector, I would say, that potentially can really be the change that we've all been talking about. And I don't think sometimes we do enough to make those connections. So I'm deeply committed on behalf of my membership to be thinking about the ways in which we do public-private partnership in a whole new way. And I'll talk just a little bit about that before I turn it over to our panelists. And so if you just think about the vast network of committed individuals who care deeply about strengthening their families, I think it can give us some hope to address some of the challenges that we've already talked about today. So let me talk briefly about how this session is going to go, then share with you a little bit about the work that we're doing at APHSA, just to set some context that many of the things you're going to hear about from our innovation leaders here today are also being talked about in the public sector side. So each of our panelists is going to come up and do a presentation about the innovations occurring in their organization and share with us, hopefully in around a 10-minute period. I actually have been tasked with also timekeeping, and so because I want to be friendly about it, at the 2-minute mark of your 10 minutes, I'm going to show you a picture of my dog, whose name is Sweetie. It's just a gentle reminder to try to wrap it up, okay? Again, I think there is an incredible amount of energy and momentum in this country to think about how we ultimately strengthen our communities, have healthier communities, have better outcomes, and are thoughtful about the ways in which we have gainful employment and independence for the people that live in communities, and how we strengthen the sustained well-being of our children and youth. Those are the principles by which our members, who again are from the public sector side, are really thinking about our work. We call it Pathways, the opportunities ahead for human services, and on your way out there'll be some materials so you can get some context about the work that's being done on the public sector side. But I'd just like to take just a couple of minutes before I introduce our first panelists and share with you something about what we see as that desired future state, because I heard so many of these words and ideas come through today about what we want our health and human service system, and ultimately our communities and the individuals in those communities, what we want it to look like. Authentic voice, really actually understanding what it is that the folks that we are walking alongside of, I love whoever said that earlier, about what that really means to support them in their desire to be self-sufficient and to have gainful employment and to be healthy and a contributing member of their community. Services that are integrated and aligned, right, that actually get the right service at the right time and for the right duration, and not about dependency on government, about doing things that are about getting prevention and early intervention earlier so that we can reduce actually that dependency on government supports. And these are the kind of things that I hear from across the public sector leaders every day. Thinking about how we operate in a shared governance, and what does that really mean, right? We're shifting from kind of working in our individual silos or organizations to thinking about how we work across those lines. And it does require us to think about our work in a different way, to think about the models of business that we have to have at our tools every day to be able to go into the challenges that we just talked about and actually deliver on them, and maybe let go of some things that we all have that are programs that might have been near and dear to our heart for a long time, but maybe they're really not working, and we need to be thinking about how we do that together. We have to be accountable for results that matter. I think there was comments earlier today about outcomes, not inputs. That's a huge component of the conversation that's occurring within the public sector leadership. Not as easy to get to, right, as to what those actual outcomes look like. Although I think we probably, from a global perspective, could have a lot of consensus in this room. How we deliver on them and measure them is something altogether different. But we have to have, I think, a shared commitment to make that happen. And then the last point I'd like to make, and I'm going to say it twice because I think for the purposes of this panel it's really important, is that we have to have space for creativity and innovation, and we have to be not as risk adverse as we have been. We have to be willing to fail at least a little and learn from that quickly, and then move forward. And I'll tell you, from the public sector side, we've never been very good at this. We don't build into our space the kind of testing of ideas and ability to fail and learn from it. We also don't leverage the incredible amount of innovations that have occurred across this country in this nonprofit sector. And Father Larry said this earlier, and I couldn't agree with him more, that there's been an incredible amount of innovation that has occurred by the leaders that are in this room. And we, on the public sector side, need to find a way to leverage that more and connect more for the value it means for the collective impact we're trying to have, not for some sort of linear contract arrangement we have between a state service and a nonprofit provider who's delivering a service. So I think you all are leading the way in that way. I think we're going to hear about some really great innovations about how we think about addressing and reducing poverty. And I'll tell you, in our world, we talk about it in terms of strengthening and having healthier communities and moving to a system that's transformed. I think Susan mentioned this earlier in terms of the challenge around the concepts of poverty. However we approach it, though, I think that we have to find a way to highlight out-of-the-box thinking to capture ideas that are non-traditional in their approach, and then to be willing to share them and spread them in a way that really has the kind of collective impact we want. So without further ado, I'm going to turn it over to our first panelist. Major Darryl Leedom is the National Social Security Secretary at the Salvation Army and is presenting their initiative, Pathway of Hope, and I couldn't love the title more. So talk about synergy.
Thank you. Thank you for the opportunity of being here today. I feel as much as if today this is like a locker room. And we're all team members, we're all part of the same team, and we've gathered together to kind of get, excited about a common goal, a common win, a victory, right? So this is like a locker room. It doesn't smell like a locker room, but it's like a locker room, and instead of using the term space. But no, delighted to be here. The Salvation Army has been in America for 134 years, fulfilling its mission of meeting human need. And in the most recent of years, we've had an enormous number of people who've looked to the Salvation Army on a daily basis to say, Salvation Army, we believe you can do something for us, for me, and the basic needs. And so the Salvation Army is actively involved in addressing basic needs, providing food, housing, and a host of other events. However, recently, about 2 years ago, the Salvation Army of the Central Midwest region launched a new initiative called Pathway of Hope, and it was designed to address the issue of intergenerational poverty, families locked, imprisoned by poverty. Our co-founder, Catherine Booth, along with her husband, William, founded the work of the Salvation Army back in 1865 in London, England. And this is one of her quotes: "If we are to better the future, we must disturb the present." And if we are to better the future for some people who are coming to our doors today, we have to disturb the present. And that kind of was a catalyst that allowed the Salvation Army to take a look at its deliverable service and say, you know what? We like what we're doing, but we need to do it better. We like who we are, but by no means are we at our peak. And so with that, they began to take a look at some resources. And what came out was this idea of a pathway of hope. What we know is that there are millions of people in crisis every day. And last year, the Salvation Army served 30 million Americans alone. That's one every second, coming to us for some sort of basic need. We have millions in crisis. We have a shift in funding. We are 88% funded by private donors who say to the Salvation Army, here's my $20. I believe you can do something with it. Here's my gift. I believe you can do something with it. So we're heavily, heavily dependent upon the private contribution of those who say to the Army, I believe in you, and I vote with my contribution, as well as our own desire to do even more good. Because we are called, we are a faith-based, we are a mission, we are a movement about people. People are the priority of the Salvation Army, to bring a better life for them. So what came through was this pathway of hope. How are we responding to this ever demand of increased need, increased service opportunities? And we are committed to serving. We will always be about serving. We've been tracking outputs forever. That's always been mentioned. We've been very local. But however, we kind of stood back and said, wait a minute. We need to be about solutions. We need to be about solving the issue of poverty for people. We need to be more intentional about the outcomes of our service delivery, not simply the number of beds filled or the number of meals served, but what has been the outcome of being with a family, journeying with them. And we need to have a shared vision that people's lives can be different. So again, the pathway of hope, still committed to serving and outputs and local response, but really kind of layered on this idea of solving and driving home outcomes of our work and alleviating poverty through a shared vision with community partners. So the Pathway of Hope really is an approach to provide targeted services to families. Again, the Pathway of Hope is for families of intergenerational poverty who desire to take action. Families who desire to take action to break the cycle of crisis. And this is kind of one of our little schemes that we use about the Pathway of Hope. We have families who are in crisis. And when you are in crisis, you cannot make good decisions. Everything is a storm. Every event is a new storm. And so our idea of the Pathway of Hope is we move families along this pathway, you might say, from crisis to vulnerability. Because even in vulnerability, you reduce some of the crises or some of the barriers. And even in vulnerability, you can begin to make some informed decision making. You can begin to take some ownership, some action. And then hopefully you move into increased stability and ultimately self-sufficiency. But again, it helps clients break the cycle of repeating crisis by putting them on a path towards increased stability. So this is that trajectory we want to put families on. They come to us in crisis. We sense in them a desire to take action. And that desire, accompanied by the work of the Salvation Army, can put them on a new path, a pathway of hope. And it involves a couple different elements as the screen rolls up. It involves empowering vulnerable families to take action. I've kind of mentioned that already. It's optimizing the Army's resources to address the root causes of barriers. We had to take a look at our own delivery service and say, maybe we need to change our model of service. Instead of crisis intervention, perhaps a strength-based approach. Instead of looking at each individual as a crisis with a person with a deficit, moreover, an individual with assets and strengths. And how do we work in partnership with the client, the consumer, to begin to put them on a different path? So empowering vulnerable families, optimizing the Army's resources, and one of those resources is our name and our trust factor. That's one of our resources as well, but also catalyzing community collaboration. And this is great. About 3-4 years ago, the Salvation Army looked around and said, you know what? We cannot play in the sandbox alone. We need to play in the sandbox with others. And so at the national level, at the regional level, the Army has been very intentional about creating community collaborations. We like to say we'll collaborate widely and we'll partner deeply. Because, you know, we like who we are. We can tell you how good we are, but we here in the locker room are far better than we, the Salvation Army. And so that's really a strong point of this whole Pathway of Hope. Recognize that within the community, there are resources that we can help broker and link families to. It's an approach, again, it's designed for families. We don't apologize that. We're trying to break the cycle of intergenerational poverty. It's a desire to take action. It utilizes a strength-based perspective of case management. So journeying with, we've talked about that before, journeying with, journeying alongside the families. It involves models of change and just a whole bunch of different, this aspect of receiving a participant and saying to them, we're going to journey with you and then release you better. That's kind of this idea of the Pathway of Hope initiative. So we're excited about this. Some key principles: people have capacity. People have a capacity to learn, grow, and change. I love the story earlier about the two mothers who had the same desires for their children, yet one found themselves with less social economic means, but they both want their kids to be successful, right? And so this idea, people have the capacity to learn, grow, and change. Again, from a strength perspective, the consumer, the client comes with strengths, not from a deficit proportion or perspective. The client is the director. The client really buys in and takes some ownership on setting some goals. Relationships, it's about relationships. It's not about a one-stop conversation and done, but really a relationship. So tell me about your children. Tell me about what if nothing changes in this scenario? What would you like to change? How do we connect you to those sort of resources? Community, because it's about that support. And then you can read it all. That's good stuff. Again, this was in the Midwest region. In October of 2012, 3 units launched the program. 3 units, Green Bay, Wisconsin, Gary, Indiana, and Elkhart, Indiana. So 3 kind of very diverse and different communities took a look at their Salvation Army basic social service, family services system and said, we're taking these 3, we're going to pilot it and see if the Pathway of Hope can begin to engage families who desire change and put them on a trajectory towards success and sufficiency. That has since mushroomed to 100 units in the Midwest region. That would be from North Dakota down to Kansas, slide over to Indiana, and come up to Michigan. So this is being piloted in that Midwest region right now. And within 3 years, there'll be over 270 locations that have a Pathway of Hope approach actively involved in its delivery. We'll still continue to receive people who just want to see us for a parcel of food or a rental assistance or something, but for those who desire to take action, to be a part of the case management plan for change, we want to journey with them on this. And so it's still very new, but it's operational. I am excited to announce that there is an internal self-study group going on taking this approach to the 1,400 units across the U.S. So it will be in 270 units in the Midwest within 3 years, but then hopefully there'll be a rollout across the nation as well as we engage with families. William, with one of our other co-founder, said this is a nice little quote at the end. If he has lost all heart and hope and power to help himself, he must be inspired with hope and have created within him the ambition to rise. Otherwise, he will never get out of the horrible pit. And there are people today who find themselves living in the horrible pit of poverty. And they've been there for a long time. And how privileged we are to come alongside them and hopefully through relationship and through opportunity, allow them to lift their head, sense a different vision, sense a different path, you might say, and journey with them along this way. So the Salvation Army is deeply committed to service and engagement with others through the Pathway of Hope, and we want to be about change. May God bless you.
You had 10 seconds to spare.
Hey.
All right.
Our next presenter is Jessica Jelinski, who's the Director of Partnerships, and her colleague, Eileen Hyde, who's the Director of Network Engagement from Feeding America, and they're presenting on their Collaborating for Clients initiative. Jessica.
Thank you. We are very, very excited to be here today. This conversation that's been happening today sort of mirrors the conversation that we have every day in our office, which we share, by the way. So we're going to share this podium. We share a brain half the time anyway. So, but really exciting. work that everyone is doing and the conversation around moving from outputs to outcomes and programs thinking to systems change is really the guiding principles behind the work that we are doing. And it may seem very similar to Major Darryl's presentation, which is a very good thing. So we want to start, so Feeding America has been working on this behind the scenes for about a year, really to get to the point where we could start to have a conversation with all of you. So the work we've done has really been around designing, putting a little structure and some thinking around the Collaborating for Clients initiative, just so that we can open up a conversation with other organizations. It's not about Feeding America, this work, it's about the people that we're serving collectively. So we wanted to start with just letting you know a little bit about Feeding America if you're not familiar with us, a little overview of food insecurity and the needs that our clients are facing, and then Eileen is going to tell you a little bit more about Collaborating for Clients. So if you're not familiar with Feeding America, our vision is a hunger-free America, and our mission is, it's actually twofold. It's to feed America's hungry, but also to engage the country in the fight to end hunger. So if you think about outputs to outcomes, the output part is really that feeding, and really what we're thinking and focused on is how can we move to impact beyond meals. So our network is, Feeding America is the national office for the network of food banks across the country. Currently, we have 202 food banks who work with 61,000 agencies, many which are part of the networks that you all have. And collectively, we serve 37 million Americans. So Feeding America, every year we release Map the Meal Gap, which is a study that looks at food insecurity at the county level. And we know from that research that the drivers of food insecurity are unemployment, poverty, and lack of assets. So for the 49 million Americans who are struggling with food insecurity, we know that food is not their only need, that the issues that they face go deeper than that, and that they don't exist in isolation. So we also release research every 4 years called Hunger in America, which looks at client household data. And we were able to look at that as part of the Collaborating for Clients initiative. We took a look at that data specifically for households with children, which is our target population, so families, the same as you. And we found some really interesting statistics that point to the needs and issues that our families are facing. So 40% of respondents rated their health as fair or poor. More than half of the households that we serve have unpaid medical bills. Over 50% of client households report that they have to choose between paying for rent or food. So housing is actually one of the biggest trade-offs. And all of this information and everything that we know about the people that we're serving, if you think about that, combined with our mission and our vision for hunger-free America, what we realize we have is a pretty complex social issue. It's one that Feeding America cannot solve on its own. Our food banks can't solve it on our own. So we really need to figure out how to partner together to help the people that we're serving. I'm going to turn it over to Eileen, who's going to talk more about Collaborating for Clients.
All right, thank you, Jessica. So I'm going to talk a little bit about, given this background information, what we know, the process we went through, where we are right now, and some of our initial visioning for how we would like to move forward in the future. And I think today's discussion about what the future could look like across not just our organization or our network, but social services together really is a good launching pad for this discussion. And I want to thank Catholic Charities for this conversation, or for bringing us all together, because I think being here today has just really reinforced the need to continue this conversation moving forward. So one of the things I want to say is we're really still in the developing process, whereas you were, rolling in a program out, we still in which is actually perfect timing to continue to have this conversation right now. So about a year ago, Feeding America partnered with the Laura and John Arnold Foundation and brought together a team of food bank executive directors, as well as partnered with the Urban Institute to answer this motivating question. How can Feeding America leverage its core service of food provision and also build partnerships to help clients live more stable and self-sufficient lives? And we went through a year-long planning process to do a couple of things. One, we wanted to look at client data as well as outside literature, to really understand what are those factors that hinder client stability and self-sufficiency. I think we all know, but to really understand that. And then we looked at other sectors, primarily the education sector, to understand what are some successful best practices in collaboration as well as collective impact initiatives. There's a lot of organizations that have been working on doing things collectively to move towards outcomes. What can we learn from those sectors to bring to social services in general? We still have more work to do, but I wanted to kind of share some of the recommendations that came from this year-long planning process about how we might think about moving forward. And really, my goal for this conversation or this presentation is to help kind of open the door to those conversations with you all, because there's more to develop. So a couple of things that came out of this process and this work is initial focus on households with children and helping households with children get on that pathway for self-sufficiency and stability. Priority need areas for partnership are housing, health, income, and food, and really looking at those are the stabilizing factors for a family, and how do we partner together with different organizations that are working in these sectors to drive those outcome changes. And our approach. So I'll be honest, I think a year ago, we thought we would find that one program out there, that silver bullet that's helping families achieve stability and self-sufficiency, and we would just scale that, because that's how Feeding America has traditionally approached food distribution programs. Well, we quickly realized that it's not about one single program, it's not about one single programmatic outcome, as well as the fact that client or community, I want to say assets, resources available, as well as needs really differ. And there might be multiple dials a community wants to turn to be able to see those positive outcomes. So we recommended, or it was recommended to us, that we look at supporting local collective impact and planning initiatives to bring communities together to think about a vision and start moving the dials in those areas. To ladder up to these, this is kind of the graphic, our sandwich over there, of stability through food, health, housing, employment, and income, and those outcomes. Now, you'll see that there's a top half of this sandwich, or hamburger, whatever you want to call it. It's not the best illustration. But that's the national collaborations. And realizing that while you have local collaborations that are happening at a local level, and we would collectively be supporting that, we need national leadership and coordination, which I think it's really great that we're all in the room talking about this today, to set that leadership and support those local collective impacts so that we can have engage in mutual reinforcing activities from the national and local level. While those partners might not look the same in every local community from the national level, we can all start to funnel resources and engage in activities that will drive outcomes in these areas. So that's kind of the overall vision. I want to talk a little bit about, just quickly, because I know I'm probably running out of time, the bottom half of that sandwich of what this could look like at a community level. This is just an illustration of what this could look like, but really bringing all of the organizations in this room at the local level, we know we all have local affiliates, putting the families that we serve in the middle and working with them to understand what are needs, what are opportunities, what are these destabilizing factors, to then align on a vision for the community change that they want to see, and figuring out what specific dials they need to turn, thinking beyond just one program, but what do we need to do in our community differently to achieve that positive change. Now, I think we've all been collaborating for years. We come together and we collaborate around programs, but this is about collaborating around community-wide outcomes, even if we don't know what the change needs to be at that time. And then putting the measurement and rigor in place on the front end to actually then show that impact. Talking about how do we move to that outcome. And we have a lot of work, I think, across our organizations to get at that. And then agreeing on how we want to work together, enforcing those engaging in mutual reinforcing activities and driving that change. And hopefully, looking at this outcomes framework over here, is we see the umbrella of family stability and self-sufficiency. Well, all of our organizations play a role in that. We all have sub-outcomes that will support families, and seeing that we might have individual responsibility, but we're collectively accountable for that outcomes. So seeing how that all fits together. And I just want to comment on Susan's remark that she made earlier about moving away from just thinking about programs, but community-wide outcomes, and how do we support communities in that. So thinking about that top half of the sandwich that we talked about earlier, well, what can the national role be or look like? And I think there's a lot of opportunity and work for us to come together to think about how would we support communities in going through this type of process, and how do we coordinate. So we've already started to engage in conversations with organizations in this room, and we hope to continue thinking through this collectively and collaboratively about, could we develop a national outcomes framework What would that look like for us? How would we hold ourselves accountable to that and support communities in doing that? Could we create a framework to support communities, co-create a framework to help communities go through this collective impact in social services to start rethinking how they do this work? And then could we collectively develop a plan about how to build capacity of organizations to do that and be coordinated? And then hopefully, eventually we'll start to learn things that work, that can fuel a national policy and advocacy agenda to really transform those systems and fuel our resources. So I just want to thank you all for having us here today, and I hope we continue to engage in conversations to think about how do we have real transformational change across communities across this country. So thank you.
Wonderful, and a lot of synergy already. No pressure on you at the end of the table. Our next presenter is Sharon McDonald, who's the Director for Families and Youth at the National Alliance to End Homelessness, and she's presenting on rapid rehousing. Sharon.
Thank you very much. I'm delighted to be here. I think homelessness is an area where we've seen a tremendous amount of innovation, largely because of our partners at the local level, many of whom are represented by national organizations that are here. If you'll pardon me for doing this, I think it's very important for me anyway to make sure that we're all on the same page as far as the context. So we heard a little bit from Nan, my boss, about the needs, the incredible number of people with poor housing needs. So we have nationally, our best data says that 3.24 million families with children have worst case housing needs. In case you're not from the housing world, what that means is that you have very low incomes and you pay more than 50% of your income for rent and you live in seriously substandard housing. So housing instability, people who are sort of hanging on by a thread to the housing that they have, is pretty common in our country. And of course, the most precarious and the worst off are families without housing altogether. And so HUD is serving, through their HUD-funded programs, 175,000 families per year. And on any given night, there's 31,000 families, people in families, and that includes children, who are living in unsheltered locations. And what that means is cars, it means campgrounds, it means garages, it means abandoned buildings. So shelter, unlike some things, is not an entitlement. Because you're homeless doesn't mean you have a place to stay. So who are the families that become homeless? Well, predominantly they're very poor. That's not surprising. About 41% of the poverty level is the average income. What is pretty surprising, I think, is the age of the parents. They tend to be very young themselves. I was on a call recently with some leaders from some national cities that's working on homelessness. As many as 30 to 50% of the households they serve are headed by a parent under the age of 25. What may also be surprising to you is the age of the children. Over half of the children served in HUD homeless service programs are age 5 or under, and researchers tell us that the age that you're most likely to experience homelessness in your lifetime is at 1. So essentially, infants are more likely to be homeless than toddlers, toddlers more likely to be homeless than preschoolers and up. So it skews very young, not surprisingly, very vulnerable families. So the way that we've responded to homelessness is transforming very, very quickly in this country. I've been working on homelessness. I started in the front line in 1989, so it's changed dramatically since then. But there's a lot more work to be done, and we need to speed it up. Traditionally, we've offered emergency shelter has been our primary response to homelessness, and that's been essentially emergency shelter offering as a safe haven, a temporary respite, a place for folks to get what they need to heal. And typically what people do when they get into shelter is they work very, very hard to get out. That's, nobody wants to raise their family in shelter. So they are scrambling to get what they need. They may be scrambling to get a job if they've recently lost one. If they get a job, they're scrambling to get the first month's rent and then a security deposit, and then trying to figure out somebody who's going to let them rent to them somewhere that they can afford, often on their own. They're trying to do this while meeting perhaps welfare to work requirements, other kinds of things, whatever the parents, whatever the school wants of them from their for the young children who are in school. So essentially, it's a lot of work to be homeless, as you might imagine. So that's been the predominant response to homelessness, and for a small subset, 20 to 25%, we've provided a richer response, and those are long-term residential programs called transitional housing, where families might stay for up to 2 years, and the idea is that we would package a lot in those 2 years to help people with job training and perhaps finishing their education and providing services to children and parenting. And so that is only ever really served about 20 to 25% of the families who actually enter homelessness. Most families who enter transitional housing programs don't stay there terribly long. Most exit very relatively quickly. Again, parents want to be in a home of their own. And what we've found over the years is that in large, you can't say it of all programs, but the families who are getting selected into transitional housing programs aren't necessarily the most vulnerable or the neediest. They are the ones that perhaps we see as on the best trajectory to success. So there's been this kind of shift to the resources to those most likely to succeed, while the vast majority of homeless families struggle and then are expected to move out of emergency shelter on their own. So what we've really seen lately, and there's been some big investments, including resources from the Stimulus Act with the Homelessness Prevention and Rapid Rehousing Program, the idea of a new approach. And essentially, it's not rocket science if you think about it. It's helping parents do exactly what they're trying to do, what you imagine they would be doing. It's helping them do what it is that they've been trying to do on their own, which is they've been trying to get enough money to get it together to rent an apartment. They're trying to find a landlord who's willing to rent to them. And they're trying to get packaged what it is to meet their family's needs. So it's essentially providing those services up front so families don't have to sit in shelter, and we can move them through and out of homelessness more rapidly and back into housing of their own and back into communities. So essentially, instead of waiting for that parent to find that first job and that first month's rent and save up maybe for that security deposit, which could take up to 2 or 3 months. So if you think about it, it's providing that financial assistance. So instead of providing shelter for 3 months, you might provide rent assistance for 3 months. Instead of asking that parent to negotiate with landlords on their own, you're with that parent and you're helping them negotiate with landlords with them. And you're helping to entice the landlord to overlook perhaps some other kinds of things that are going on in their criminal background. And then you're following it up. This is not, sometimes it gets seen as, you're just throwing them out back into housing and out of your shelter. It's following up with the case management services. So the places that are doing this well, the places that I'm the most pleased about and that I'm most happy to trumpet are folks that are really working intensively with parents to find employment and to make sure the kids are linked to school, but really making sure that they're making sure that the parents are getting and the family is getting what they need to not only get into housing, but to succeed in housing and not to return to homelessness. So what we've seen, this is sort of a summary sheet, but essentially we're able to rapidly rehouse more families at a lower cost than some of the longer term interventions. So something like transitional housing can be as much as 5 to 10 times as expensive as a rapid rehousing intervention. Comparatively, they're less likely to become homeless a second time, and they're more likely to exit homelessness into permanent housing. And then I think, again, in a community or in a world where we have 31,000 people and families who are unsheltered on any given night, I think actually one of the most compelling arguments for rapid rehousing is the efficiency one. It means that we're able to stretch the dollars further so that nobody is unsheltered, so that we can really be a response for all, not just a fortunate few. So here's just some outcomes compared from some different communities. So the average cost of a permanent housing exit with rapid rehousing is $4,000 compared to $22,000 for transitional housing. There's a recidivism for singles and families. But again, I think the most compelling arguments are from systems level. What happens at the community level when we really invest in this approach? Trenton actually uses TANF resources, so they actually have a rapid rehousing program right inside the welfare department, which I just think is awesome. It's like what I think welfare reform is supposed to have done, or welfare agencies should be doing. So by investing in rapid rehousing and deploying some of their TANF caseworkers to help people with employment, negotiate with the landlords, and to help with rent assistance, they've decreased their family homeless census by almost 2/3. Salt Lake City has reduced the length of time families are homeless and in shelters by half. One of the important outcomes for Salt Lake City is that they were, during the recession, they were at a point where they were either going to go to church basement overflow shelters for families, but because they decided to invest in this approach instead, they were able to kind of sustain the status quo without building another shelter. So essentially for each family that was showing up, they were rehousing. So they never really had to build capacity. They built their capacity to rehouse rather to shelter. And then Las Vegas, this is a benchmark. It's not my favorite benchmark because nobody should be unsheltered, but that's where they decided to focus their energy to really go after the number of families who are sleeping outside on any given night and increase capacity by investing in rapid rehousing to create some more room. So this is something the federal government is investing a lot of resources on. We're very pleased. There's been great outcomes. They're doing it with vets. It's working with single adults and with families. So that's me.
All right, I'm going to move us along. Sheila Gilbert is the National President of the Society of St. Vincent de Paul, and she's presenting on their Systemic Change Initiative, something we've definitely been talking about all day.
You can see this is titled Transforming Lives, Ending Poverty Through Systemic Change. And I want to just give you an overview of how the Society came to this approach and exactly what the approach is. Can you go ahead and do the slides for me? Our service trends. We are looking at the value of our services are going up, and they're going up fairly rapidly. Next slide. But in terms of home visits, which is our primary work in the Society, is home visits, which means that when a person needs help, they call and we send 2 people out in order to visit them to see what their need really is and how we can best fulfill it. During the crisis time, we really put all our efforts into trying to meet those immediate needs. But what we are discovering is that over time, our ability to do that is actually lessening. People are just wearing out and the resources are wearing out. So we need to find something else, because here we know that the number in poverty keeps going up. And we know that our ability to keep pace with that is just not going to be there. Okay. So our question for ourselves is what we are doing actually transforming lives? Are we just enabling people to survive in poverty, or are we helping people to move beyond survive and move to thrive? Our vision then became end poverty through systemic change. And the reason that we came to this was that we have a belief that when a child is born, God never looks at a child and says, you will live and die in poverty. You will struggle all your life and you will never know success, and you will die feeling you are a failure. And we believe that if that is not God's will, then it should not be ours either. And so that's what we are committing to change. one person, one neighborhood, one community at a time. We are very much a grassroots organization. We are in 4,300 neighborhoods, Catholic parishes around the country, and I believe in almost every major and minor community, and I believe there's only one state we're not yet in, and we're going to be there shortly. Because we have this very grassroots approach, what we have decided to do is to use our strength in the neighborhood, in knowing who our neighbors and our friends are, to build long-term relationships with those neighbors. We know that for systemic change, we need to find out what the root causes are and get a deeper understanding of what poverty is really about for each of the families or the individuals that we're serving. So what we're looking at and understanding from our founder is that the way that you do that is that you are in the person's living situation with them, and you are in it over time, so that you really begin to know. Our founder was in Paris in 1833, and he said, you need to climb the steps of the tenement, you need to sit at the bedside of the sick and the dying, you need to be with the children who are hungry in order to really understand. And that's what we have come to, that understanding is that for us as the St. Vincent de Paul Society, for our members, we need to really develop long-term relationships in order to truly understand the situation of the people we're serving. Because when we try to do that across a desk, when we try to do that in a location other than their own location, we never get the full picture. What we get is what they need to tell us in order to get what they think we can give them. And we want to begin to move beyond that to understand root causes. We also know that as the St. Vincent de Paul Society, we have almost 150,000 people across the country who do this kind of work. They are extremely committed people. Some of them are going to do something maybe only once every 6 weeks, but the vast majority of them are doing something 2, 3, 4, 5 times a week. These are people who don't eat their own supper until that call has been met and they're sure that somebody else has their supper. So they have built very strong commitments, very strong attitudes about the best ways to do this. And we are transitioning and trying to help our people transition to understand that there might be even better ways, that this is a different world and there may be new and better ways to do things. So we are looking at competencies, behaviors, processes, and programs. We're looking at going beyond the immediate needs that a family has. We are also looking at this idea of partnership, and I've heard it here over and over today, is that we walk with the people that we are serving, and we do that from the perspective that we are going to gain as much as we're going to give in that relationship. We also, like I heard some other people say, is we do this knowing that we are looking at the strengths of the people that we're serving and helping them to build on those strengths. We are also knowing that we have to change the structures in this country. There are barriers in each of our communities, in our neighborhoods, in our cities, in our states, and certainly at the national level. We all know those barriers are there. We need to really understand what those barriers actually do and what needs to be removed and changed. And we really believe that the best place to find that out is from the people we're walking with. They know best what needs to be changed in order to make the system work for them. We've adopted Bridges Out of Poverty as a set of constructs and models and methodologies that we're going to be using. Probably many of you have heard of Ruby Payne. She now has a partner in her work called Philip Duvall. And Philip has put a book called Bridges Out of Poverty, Strategies for Professionals and Communities. They have a cradle-to-grave approach to ending poverty. They have it's an economically based and different lenses, different ways that different economic levels look at the world and plan how they are going to be in the world. This has been very helpful to help us understand the people that we're walking with. We really believe this mutual understanding is very critical to establishing the relationships and empowering the individuals. We want to, and Bridges does, address all causes of poverty. The behavior of the individual, we all know that sometimes people make bad choices, but we also know that in our communities, sometimes our human and social capital is not sufficient, and we have to work on building that inside our communities. We know that the poor are exploited. Payday lending is an example of that, but there are lots and lots of other examples too of the ways that some people are getting rich off of what is happening to people who are struggling in poverty. And then we know we need to look at the political and the economic structures. Another key point is that it's not the social service agencies or the churches alone that are going to solve this. It's not government. All the classes and all the sectors have to be able to come together. All the political persuasions need to be involved. And we need to be sitting down both on a local community level and on a national level to bring together business, education, government, healthcare, transportation, all of those things that go to either create barriers or create opportunities for people. We all need to sit in the same room, and we need to have people in poverty in that room with us, helping us and guiding that discussion. The goal is that we want to build communities that are sustainable for all of their people, not just some of their people, but for all of their people. So the cornerstones of our effort are going to be empowerment. We're looking at, first of all, empowering ourselves with education, with understanding more about poverty, with understanding the lives of the people who live in poverty. We also want to really focus on empowering the people who now struggle in poverty. We want to empower them to understand and believe that they can actually make a difference. We are going to mentor in the sense of walking with others. We are going to really work at collaborating, and I've met a lot of potential partners here, and advocacy is a strong piece for us. Knowing that as we work in local communities, we will see what the needs, the problems, the barriers, and opportunities can be, and we will raise those then to an advocacy level. We are going to really work on this ongoing relationships and engaging all of our Catholic parishes in advocacy. And then we're going to do this about really working on sustainable communities. Right now, our National Council is putting together, and we are providing training. We have done it for 34 of our councils. We will be doing 2 more sessions and probably another 50 or 60 of our councils this summer in order to really make this rolled out across the whole society. Okay? I think that's the last one, yes. All righty, that's what we're doing.
Thank you, Sheila. All right, so Candy Hill, I think probably just about everybody in the room knows, is the Executive Vice President of the Social Policy and External Affairs here at Catholic Charities USA. And she's going to come forward and speak to us about their, do you call it NOCRA? Do you go by the acronym? NOCRA Laboratories.
So I'm last on this panel, and I'm amazed over the last few weeks since Father Larry called us all together how much everything we're doing is so alike, and the alignment is really amazing. I need to change the slides, right? There we go. So for those of you who are from Catholic Charities have heard this acronym NOCRA before, the National Opportunity and Community Renewal Act. And for those of you who haven't heard it before, I'm just going to give you a very quick rendition of how we got to NOCRA. And not surprisingly, you're going to hear some themes that we've already heard. We had a natural opportunity at several places in our history over the last few years to actually say something significant about poverty. And with the support of our national board and our membership, we actually began that after Katrina. When Katrina hit, it was very apparent that those that were of color and who were poor, who were left out and left behind. And as a result of that, we wrote a policy paper on poverty in America, a threat to the common good. And we didn't stop there. We actually wrote another piece to that, which is poverty and racism, overlapping threats to the common good. And the question of our membership was, how do you keep this alive? How do you keep this conversation alive? These are great papers, but we have a tendency to write things and then kind of leave them on the shelf. And so we created a campaign to reduce poverty in America very quickly in 2007, when the Democrats took both the House and Senate for a brief period of time. And we stood on Capitol Hill in a packed Ways and Means Committee room with a lot of national partners saying, we can actually reduce poverty in this country, and we're all going to work together to do it. That was a noble cause. And then we had another natural moment in time, which was a 100-year centennial. And so that gave us kind of a lift that other organizations might not have. And so our national leadership said, we should create something that helps us have a conversation about this and begins to move change in our policymaking arena in the United States. And so the National Opportunity and Community Renewal Act became a piece of legislation that actually got introduced in the House and Senate on the day of our centennial in September, which is coming up on 4 years ago. That wasn't an accident. We spent a year in 2009 and 2010 traveling around the country to many of the communities that we all share, our members on the ground. We talked to people from United Way, the Salvation Army, from government, from Catholic Charities, about poverty in their communities, in their region. What did it look like? What are the innovative ideas that you're actually doing in your community? What are the barriers that are in your way of helping people that really could get out of poverty? And finally, what if you could say anything you wanted to policy and makers in Washington, D.C. That we could carry back? And this was all chronicled in a book written by Father Larry called Think and Act Anew, Poverty in America and What We All Can Do About It. And in the back of that book, there's a listing of the innovative programs that we discovered along the way, and there's a list of the ideas that people from all over America gave us. And we convened a whole lot of really smart people to actually do a white paper. And then ultimately, we're coming home here to Aaron Fox, because Aaron Fox was our partner in actually writing the national legislation that actually became the National Opportunity and Community Renewal Act. That process, as I look back across those years, was easy. The idea of introducing legislation in a time when we couldn't have seen how polarized Washington, D.C. would become, or the hyper-partisanship that we face today. I thought it was ironic when Major Garrett asked our two friends this morning about a caucus, because folks, neither one of them could actually get a bipartisan caucus started, because the leadership would never approve it. And so they're asking us to do that as kind of a reflection of, you call us together and we'll come, but we can't call you together and you come. So I think that's what we've been facing, all of us, in the struggle over the last few years. But that hasn't made us give up. And the strength of Catholic Charities is really not here in Washington, D.C. The strength of our movement is on the ground with our leadership. It's about the services that are being provided every day. It's about the people, the 10 million people that we're serving. And the ideas that we had for NOCRA actually came from our own communities, our own membership. And so this year, we've decided that we're going to return to our roots, which is really going back to communities. Many times we talk about the silos that are in Washington, D.C. We talk about the programs that come from the federal government. We refer to them sometimes as poverty in a box from Washington, D.C., one size fits all. You heard some of that today. Unfortunately, poverty doesn't look the same in Detroit, Michigan, where I'm from, as it does in Wichita, as it does in Puerto Rico. It looks very different, and we believe that, you know, the response to poverty needs to be customized to those communities and those people. We also believe that the people we serve are at the center of our work. And so as we went across the United States, over and over we heard, really the Catholic Charities movement is about case management services. The thing that we do well on the ground is we actually do case management. We walk with people, as Sheila said. As Darryl said, we walk with them on their journey. It's not about a bag of food, or it's not about a night in a shelter, but we began a walk with them. And the irony of that is that this is the most unrecognized service in terms of government funding that is out there, and yet it's the most successful thing that we do. And so at the center of this legislation is really that holistic approach, which looks at a person's assets, looks at that holistic person, and then creates a plan for this person. We can call it anything we want, and we weren't above stealing some things from other people. And so the individual opportunity plan really comes from special education, from IEP. But it really talks about the strengths of people, and then how do we help walk with them in a life plan that actually has good outcomes and makes them successful. The other thing that we recognize is that as human services providers, we look at the business community largely as somebody who can donate money to us, perhaps serve on our boards. But thinking about what business leaders can bring to the human services sector is something that we think is just an untapped richness that all of us could learn from. And so we really put a piece of this legislation, which was to help incentivize business in working with us. And we discovered some amazing programs across the country, including the monetization of savings, which is going on in Minnesota, the social impact bonds that are going on there, as well as spreading around the country. And really, this idea of talking to an attorney here at Fox that really said we didn't need to do anything with the tax code, we just need to understand how to use it better from nonprofit organizations. And finally, really talking about results and getting serious about it. And I know that's not easy. Sheila and I had a conversation earlier today about not all things that all of us do in this room can be measured. Not all of us can measure when we encounter a person and we treat them with dignity and respect. What is the outcome of that in a statistical way? What is it about being a faith-based organization that believes in the dignity of a person in a way that is exuded in all the mission of your organization? Those are not something that's tangible that we'll probably be ever able to measure. But there are some very tangible things that we do every day that can be measured. And so, we thought that we had a perfect opportunity to actually engage with one of the largest Catholic universities in the country to actually talk about what does results look like in human services. And we discovered a wonderful partnership with the University of Notre Dame. And some of you know that we have been a part of opening the first domestic poverty lab in the country, known as the Lab for Economic Opportunity. Now, the irony of all of these conversations over the last few weeks is I was with Darryl at his conference last week and met an economist from Indiana University who's working with the Salvation Army, who in fact invited one of the economists from Notre Dame to be part of what they're doing with the Salvation Army. And so there's this nice cross-fertilization that's going on. And we really talked about getting the folks from Leo and the folks from Indiana University together. So a nice synergy that's going on there. But the emphasis is going to be on independent, rigorous research, where practitioners and economists are coming together to actually talk about how to design research. Now, I would imagine that a lot of you in this room are social workers and human services providers. We actually brought these groups together. It was not an easy conversation in the beginning, because when you talk about random assignment to people who are in social work, there's an immediate red flag that goes out that somebody's going to be left out. But what the economists helped us figure out is we're doing random assignment, folks, every day. If you have a wait list, you're doing a random assignment. If you're only doing a program in a zip code because you don't have enough money to do it in the next zip code over, you are doing random assignment. And so having those conversations between academics and practitioners is something that's exciting about what's coming out of the Lab for Economic Opportunity. There will be results on some of the programs coming out this fall. We're looking forward to actually having the opportunity to share it with everyone here in the Washington community. And here we go. We've gone through all of that. So we decided to return locally in 2014 to where our strength is. We decided that we're going to kind of prove that what we think works. And some of our local Catholic Charities agencies were ahead of us in this arena. When we announced the poverty campaign, some of our directors took off with this in local communities, and we're moving ahead really fast. And so we're going to be going back to them and engaging them on some of the work that's being done. This map represents where we're going to go, and where we're going is no accident. And so there are two factors that work here. We've got innovative Catholic Charities leaders in these dioceses across the country who are doing some amazing things. Some of them already have projects with the Lab for Economic Opportunity at Notre Dame. And the and part of the strategy is we also have looked at who are their congressional leaders here in Washington, D.C. What committees do they sit on? What relationships do they have with them? And how can we engage their congressional delegation in helping us with these pilot projects? For those of us who work in Washington, you know it's all about relationships here. And it's much easier to have somebody who's a sitting member of Congress doing the lift on a waiver or a demonstration project or finding research dollars than it is for one of my team or myself or our outside consultants to go to Capitol Hill and say, will you help us with that? So what's happening right now is that we're engaging each of these directors in a very deep dive about their program. Our team of lobbyists and our development people are taking, and program people are looking at what makes this program work. Because one of the secrets to this is to make sure that we know if this is going to be scalable somewhere else. Sometimes wonderful programs with great outcomes are operated by charismatic leaders that just cannot be recreated somewhere else, or they have funding that can't be recreated in another community. And so that's really part of what we're doing. We're also going out to visit these agencies, and we're asking their member of Congress to go with us. And so we are pleased that we probably took the toughest one on first. And so Father Dave, I know you're up there in the audience somewhere, but Father Dave Bergner and Deacon Richard Sage is up there somewhere, invited us to Wisconsin, and we took Paul Ryan with us. And so I have to say to you that Congressman Ryan wasn't absolutely convinced that case management services are really essential. In fact, the challenge to us was he indicated he'd never seen a good case management program. And so Father Dave and his team really hit a home run. Congressman Ryan visited with case managers and clients. He came back to our team and said, okay, I'm convinced we have to have case management. Now, how do we do this and the government not getting its way? And so what we learned from that, I think, was a richness for all of us about the importance of getting out of Washington, D.C., of getting out in the field and seeing the faces of people who are being helped and meeting the people who are providing the services. We know that as service providers because we get to do that. But in fact, what we need to do is be about the business of setting the stage so that decision makers in Washington are leaving their offices and going into the field and seeing for themselves firsthand what's happening in the field that's successful, because that visit for us is going to provide, I think, some lift and perhaps some change in the thinking here in Washington, D.C. And so I would encourage all of us in this room to think about this is a way forward. The other thing is that what we've surveyed our agencies on the ground and what we've learned at collaboration on the ground among the people that are here today and the organizations that are represented is lots of times collaboration and partnership on the ground is much more successful than we know about it at the national level here in Washington, D.C. So there's a level of discovery among us that's also going on. When I was with Darryl at the Salvation Army, I was approached by at least 20 people who came up and introduced themselves to me to say, I'm working with this person, the Catholic Charities director in my community. I'm excited about the fact that the program we were able to talk about to Congressman Ryan in Racine is a collaboration between St. Vincent de Paul and the Catholic Charities Agency, where they'll be using volunteer mentors in working with professional case managers to actually walk the path with our clients there. And so I think there's a richness here that we've learned there's certainly synergy, I think, among all of us about the importance of case management and keeping the people that we serve at the center of our work. And so thanks very much for being here today.
So I just handed a note here, what I'm supposed to say. That's a good thing. So first of all, let's thank our panelists. I think it was a great discussion.